When you look at the AI, you can see that it's 1,500 milligrams, which equals to about 3/4 of a teaspoon in one day. If we were to abstain from using the salt shaker, we would be able to decrease our sodium intake, our salt intake by about 15%. But as you can see, actually, most of the salt in our diet actually comes from processed foods. You can actually look on page 168, I believe, and look at these different processed foods. The more food is processed, the higher the sodium content. So if you look at the sodium content of a potato versus making into a potato chip or a french fry, the sodium content dramatically increases the more processed that item becomes. A deficiency would be called hyponatremia, which would be low blood sodium, and they can be caused by diarrhea, dehydration. Signs and symptoms might be a headache, muscle cramps, weakness, decreased concentration, etc. Don't really see it too often, so we're not going to really talk about it very much. Toxicity. Those kidneys are responsible to flush out that excess, but some can develop edema and hypertension. An occasional very salty meal may produce edema, but it's not hypertension. Drinking more water to equalize the sodium content and will then, therefore, the edema will be reduced. However, chronic salty meals can cause hypertension in salt-sensitive people. Now, almost basically the opposite of sodium here is going to be potassium. So these foods that tend to be high in potassium are low in sodium and vice versa. So potassium is going to help with your fluid levels inside your cells, also helps with the functioning of the nerves, muscles, and heart. Potassium can help you lower your blood pressure because it decreases the negative effects of sodium on your blood pressure. It also can help reduce kidney stones and possibly reduce bone loss. One thing to think about is with medications, there are diuretics. Some are potassium sparing and some don't. Those that don't, for example, like hydrochloric acid, need to actually have potassium supplementation through the diet or with medications in order to not lose too much potassium. Not having enough potassium or deficiency or having too much of toxicity, both can kill you. So having deficiency can cause your heart to go into dysrhythmia, and if it's not treated, can kill you. And then toxicity can also cause you to go into cardiac arrest. That's actually how most people who are on death row are killed, is through a toxic dose of potassium chloride to stop the heart. Patients, like I mentioned before, who have renal disease are at high risk for toxicity because urine is how we excrete potassium, and if they're not able to make as much urine, they are going to be at risk for this. So we want to make sure that they're on a diet that's low in potassium, and we'll be checking their levels more closely. All right, iron, very important. This is a public health issue. It is not consumed adequately very much. So you can see the function there is to distribute oxygen throughout the body. The iron in the hemoglobin of the red blood cells takes the oxygen to all the cells. So it carries the oxygen as a component of the hemoglobin. Only about 10 to 15% of the iron that you consume is actually absorbed. And when you're deficient, the bioavailability does increase to about 20%. You can see that you can store iron both in the liver and the spleen and your bone marrow. And also old and damaged iron can be recycled by the body. Your RDA is really, based on your physiological need, your gender. So for example, women, we have menstruation when we're adults, and therefore we need more iron than men. So our RDA is going to be 18 milligrams, whereas a male is going to be 8 milligrams because they are able to recycle, whereas when we lose blood through our menses, we're not able to recycle that lost iron. There are two types of food sources. So the first, there's heme. This is going to be animal sources like meat, fish, poultry. These are very easy for your body to absorb. You can see there they also have non-heme in the heme. And then we have non-heme. This is going to be from mainly plants like vegetables, legumes, whole grains, dried fruits, cast iron pots. Now this iron is not as easy to absorb, so it's really important to do things to help increase the bioavailability of non-heme, and we'll talk about that. So specifically, to aid in absorption, Vitamin C is going to help your body better absorb or increase the bioavailability of non-heme iron. Then here we have those phthalates and those oxalates. These are going to hinder the absorption of iron, decrease the bioavailability. Same thing with tannins in tea and coffee or antacids, because it doesn't help, or it prevents the heme from breaking away from the plant source when you have those phthalates and those oxalates. Um, excuse me. Deficiency is very, very common. This is actually a public health issue. All levels of deficiency will affect your oxygen throughout your body. You might feel pale, look tired, anemic. You can actually cause developmental delays, unable to focus. So remember at the beginning of the semester I talked about it's really important, if I were you, to get some good iron in before class and especially before an assessment so that you are able to perform at your peak. You're going to also have difficulty with your wound healing. You might even prematurely deliver your baby and then end up having a low weight baby. Um, then toxicity can happen, but we're not going to really focus on that really at all because deficiency is really our big problem here. Other things to know too is that taking mega doses of zinc actually is going to decrease your iron levels in your body. And then let's see. That's it. All right. So then on to iron supplement tips. So things like, for example, whenever I give an iron supplement, I always give it with a glass of orange juice, unless there's a reason why, like, if they're on a potassium restriction. You don't want them to take this iron with milk because calcium and iron compete with each other, and so the calcium in the milk is going to interfere with the iron absorption. So I have more than one occasion had patients who are on calcium and iron supplements. So even though they might be dosed at the same time, I personally will separate them out because I know that they're going to interfere with each other. So we're wasting some of our medication because they're not going to be able to absorb. Another very important thing is to let our patients know that it might, their stools are probably going to be black. They can also have a higher risk of constipation because of this. And then the last really important point here that I want to make related to iron supplements is they actually all are required to contain this warning right here. Because as you can see from the label, accidental overdose of iron-containing supplements is actually the leading cause of fatal poisoning in children under the age of 6. So we definitely want to keep these out of the hands of children. So putting up ice and high if we have a patient who needs to take iron supplements. Yeah. All right, on to the next thing. So lastly here I have zinc and I have iodine, the last two trace minerals I want to talk about. So zinc, you can see it's got lots of things going on for it. It helps with growth, taste, smell, healing, immune system, and actually it might in older adults if they all of a sudden start saying like nothing tastes well, everything tastes bland, they might actually have a zinc deficiency. So we might want to try increasing their zinc consumption to see if that changes the taste of food. Food sources you can see here for zinc that are good sources are going to be meat, fish, poultry, whole grains like legumes and eggs. Related to whole grains, though, they do have a low bioavailability unless yeast is used because yeast will help break those bonds and then the bioavailability goes up. Zinc is used with over 200 enzymes throughout your body. In America, zinc sources are available in food like animals. So vegetarians do need to be concerned. You can, like I said, get it in, the whole grains there, but most of those, other than whole grains, those are all animal sources, so they do need to make sure that they're planning their diet out carefully and including yeast containing whole grains. That's the other things you can see here that also hinder absorption for zinc, if we're concerned, is actually continual supplementation will decrease the iron and copper absorption and also decrease HDL. And then you can see deficiencies might be a decrease in appetite, might be a very common way. One other thing with toxicity is, it's really with supplementation, or this other thing that actually came out like about a couple years ago now, is excessive denture cream use. So some denture creams actually now have removed the zinc, but that actually came out, people were getting toxic levels of zinc through there. Lastly, we have iodine. Like I said, I saw, a nice goiter much bigger than this, probably out to, looks completely like a softball in there. Again, we don't see that too much, but we do worry about it with sea salt. It doesn't have it. It's lost in the processing. So we want to make sure that the iodine's in there because, food sources can be water, seafood, um, and table salt that's fortified with iodine. We definitely don't want our patients to get a goiter. All right, so that should cover everything for assessment number one. Please email me with any questions or concerns.